All right. This is Mr. McMurray. If not here in person, I'm at least here in spirit. All right. And so I'm giving ACT tests, and a few of y'all are not. So y'all are going to get to see this instead. Lucky you. All right. So let's go over this. If you'll get out your handout of the pig drawing, this is what this is, of course. And we're going to do some stuff here looking at the outside of the pig, which we'll go over in person with your pig, or in pig, I guess, not in person. Person to pig. Anyhow. Tomorrow, but for now let's just look at the outside of it. Alright, so first of all, some directional terms. We've talked about directional terms, but remember, pigs are four-legged, we're two-legged, so some of these will be slightly different. Alright, let's label some of those first. Alright, first of all, anterior. On us, that's the front side of our surface. Well, on a pig, since they're pointing forward like this, that is this side of the surface. Alright, this is the anterior. And then obviously toward the other end is going to be the posterior. Alright, that's why we think of posterior as the rear. Okay, it's our back side, but for the pig it's this back half. So if it's toward the rear, it is posterior. Alright, now for the pig, if it's toward the top of their the back, that would be dorsal. Okay, dorsal is on our back also, but on the pig, that's also the superior, the top half of the body. Okay, whereas our posterior and our dorsal are the same. Superior would be toward the top of the head. Their superior is going to be toward the top of their body, which is the back here. So dorsal and superior are going to be the same direction. That means toward the bottom then is going to be the inferior and also going to be the ventral. Ventral meaning belly side. Okay, so dorsal, since they're on four legs, is the superior, and ventral is the inferior, or the bottom part. Now, if we slice the pig, or took a section, it says here, the section, all right, a section the pig where we just cut it down the middle. Now, if we looked at this and turned it sideways, all right, you would be looking at the layout of the lungs and all that part. In fact, this is the type of section that most of our pictures will be, okay, because they'll show all the insides from side to side, all right, all the way across, all right, and this section would be a frontal section. It'd be like if we put a guillotine right there and just chop the front half of me out, and you can see what was all there, okay? And that's what most of the human body system pictures that we look at very often are, in fact, frontal sections, or frontal of the back, or something like that. But still, they're looking at it from, if we'd cut it this direction and showed you the inside of it. All right. Now, if we were to chop the pig in half, all right, so you can see a round end with whatever's coming out of it there. A lot of CAT scans and stuff like this do this. They can make multiple images anywhere you want to along the body of what a cross section would look like. All right, this cross section is of course a transverse section. All right, and then in the final here, we have this one. First of all, if you slice the pig right down the middle, the type of section that would be a sagittal section. Okay, for example, I have one here. If I can make it big enough, you can see. All right, and there we go. This is a pig. All right, here's the head, and here you can see the tongue and the mouth, and then it works its way back here. And they've basically taken a pig and sliced it down the middle. Don't ask me exactly how they do that or what kind of knife or system they have for that, but they have actually sliced it in half, and you can actually see a profile of the whole pig. Okay, and we'll look at that in person tomorrow. But anyhow, that would be an example of right down the middle here, which is a sagittal section, which is kind of nice in a way because you can see how it all lays out, how it all connects. The throat goes down, the mouth, and all that, and how it all connects together in there. So that's also a useful section. All right. And so just depending on what we're trying to show, we'll look at different types of sections like that. All right. Now on this particular drawing, I forget if I did that first or did the inside-outside lines. Let me see. All right. Now first, if it's toward the middle, that is medial. If it's toward the outside or the sides, of course, that is lateral. And then the section, like we said, would be a sagittal. 1 G, 2 T's, sagittal section. All right, so that kind of takes care of some of that. Now let's look at some of the outer anatomy of the pig, some of the external anatomy of the pig. All right. We're going to divide the body up into regions. First of all, the cranial just has to do with the cranium or the head. Okay, so the cranial region would be anywhere in the head. You have a short neck region, not very big in a pig, because they don't have a long neck like a horse or something like that would. And so that is going to be called, the neck region would be called, everybody knows, it is that's right, cervical. Very good. All right, now behind that we have the rib cage, all right, area with heart, lungs, and all that kind of stuff. That would be that's right, the thoracic. And then finally, the rest of the regions of the body would be from there on down, which we're going to call the abdominopelvic, all right, because the abdominal area, let me find where my thing is, there we go, okay, my abdominal area, the urinary and all that, and eventually reproductive, but also poop stuff coming out here, depending, reproductive can be here or here, depending if we're doing male or female pig, all right, but we'll get to that later. All right, so abdominopelvic would be the last region. All right, now to name some actual things on the pig. First one we have is, I believe, start at the ear. Okay, so the external pinnae. External pinnae is this little flap out here. Not all animals have it. Moles, for example, live underground, and gophers and things like that very often don't have an external pinnae. All right, even snakes and things like that. They have a little ear hole on the side of their head, but not. And lizards, there's a lizard, Chad in the other room there, they have a little hole in the side of their head, but they don't have any ear flap sticking out. Okay, what is the purpose of the ear flap? Well, the external pinnae or ear flap, you might want to write this down, of course, is to funnel sound into the actual inner ear where you can actually pick up the vibrations. And so it's kind of just there to help pick up the signals and send them down in there. Now, you may see people that are hard of hearing, like us old people, go like this sometimes. Why? Because that increases the flap there, and if you do that with both ears, you'll find that you can hear things a lot louder and stuff like that. So it is a real thing. They used to have little ear horn things where they stick it in here and it kind of came out like a big, I don't know what to say, just like a big cone thing coming out, and it would help older people hear because it would funnel the sound in just that much better. Oh well, anyhow. That's why as you get older, you forget the name of those things, and you probably wouldn't know what it is anyhow. I was going to say it looks like an old Victrola phonograph, but I haven't even seen one of those in person, so you know. All right, here we go. Eyelids. They have eyelids, obviously, and inside would be the eye, but the eye is not open yet. So those are eyelids, all right, on the outside. Obviously, their job is to help protect the eye. External nares, which is a fancy name, which means nostrils, the openings where that they breathe through. All right. The tongue, we'll talk more about the tongue, but you can see a little shaggy stuff on it. You've probably seen that already, kind of a weird-looking tongue. But those had with taste buds and things like that. So anyhow, that's the tongue. All right, if we go on the leg, now the leg, you have to keep in mind that on a pig, the pig is actually running up on his toes. In fact, to be more specific, he's running up on his toenails. All right, and so things kind of move up from where you might think they would be in the human body. And so this actually right here is like his wrist. Okay, it's a little higher up, but here's his toes and the phalanges, and it comes, and then there's carpals in here, and then this would be the wrist. Okay, and that's kind of where we're putting the little white strings that we're using to hold the pig down while we're dissecting it. That would be around the wrist, if you will. Now, you could argue it's an ankle, yeah, whichever you want to call it, okay? But, anyway, the femur, or in this case, really be more the humerus, excuse me, because it's front leg. So the humerus would be up here, and then you would have the tibia and fibula back here. All right, or, I mean, excuse me, in this case, it's our humerus, and then you have the radius ulna back up here. All right, and so that would be kind of like the wrist, and there would be some, and that'd be your carpals, and you have some metacarpals and phalanges, and then you have actual fingernails, which would be their hooves. Okay, so we say they're toes, but technically the actual hooves are actually the fingernails. So fingers and fingernails would be the toes and the hooves, and so forth. All right, equivalent of our fingers. Now, forget if I went and did the umbilical cord. No, we did. Okay, so let's go ahead and go in order here. We have the umbilical cord. The umbilical cord, of course, was attached to the mother pig, And this is where all nutrients, food, and all that sort of stuff had to come through. Okay, and so when we look at our umbilical cord, we will try to see these three blood vessels. You can't always see them, but we will try. Okay, there's one, the umbilical vein. This is the big one by itself. If it's colored, it should be blue, if you can see that. Some you can and some you can't. But the big blue vein, and this is the one that ran up to the liver, and that when you were cutting open the pig last Friday, we were trying not to cut. That's this big umbilical vein. Okay, but there are two umbilical arteries. Okay, keep in mind in this case, the umbilical vein is bringing food and oxygen from the mom back to the baby. Okay, and it goes to the liver, which is like the storehouse for food and nutrients. It also filters out things and stuff like that. All right, then it goes up to the heart, and then it gets pumped to then the baby's heart would pump it, the baby pig or baby person would pump the blood around to their body, okay? Now, when it came back, then it would be on arteries, umbilical arteries, which would go to the mom, and that would take the blood back to get rid of waste products and stuff like that. Now, that's the opposite of how it would be once the baby is born, okay? Then, in that case, the arteries would have the blood with oxygen and nutrients and taking food back to the taking blood back to the heart. Away from the heart with oxygen and so forth. And then the veins will be bringing back the blood that doesn't have it. But in this case, since you're getting the blood from the mother pig, it's actually kind of in reverse. Okay, but notice there are two of the arteries, and that's how you tell them apart. Okay, we will talk about the arteries later when we start naming parts of the pig. All right. On the back leg, okay, once again, this is the little poop chute underneath the tail, which is the anus. And, of course, that is the tail underneath it. Now, if you have a female, they have a genitalia papillae. All right, fancy word. It says female parts that stick right out there. And if it's a male, it would have a urogenital opening, or where it urinates over here. Okay, so the female would urinate back here, the male up here. All right, and last but not least, this would be the equivalent of the ankle. Notice how long the foot, basically, if you will, of the pig has elongated. The front leg is not that long, but front trotter, but the back trotter is much, much longer. This would be kind of like the heel and the ankle there. Okay, and so it's got a little different looking there. All right. All right, I think we will, let's go ahead and do a few on this page, but we may wait till tomorrow to do much of those, but we'll go ahead and finish this page, I think, and that'll be good. All right, you have teeth, okay? Notice, if you may have already noticed when we tried to open the mouth the other day, that you already have teeth, and they're fairly sharp, okay? Unlike some animals that don't have teeth when they're born, okay? We can get to develop them later, okay? But they have teeth. The incisors, ours are in front, theirs are off to the side, and then behind that would be the second teeth, which are the canines, okay, which would be like our side teeth here, the Dracula teeth that stick out and suck your blood and all that good stuff. All right, the hard palate is going to be the roof of the mouth, all right, very ridgy looking in the pig. And if you go back toward the back, you can see where it gets squishier and stuff back there, and it loses the ridges. There's no bone behind it, so it's called the soft palate, all right. Now, there's an opening back at the very back of the throat. The opening is the glottis, so it's kind of hard to draw a line to that because it's showing the opening back there. Now, the little flap back here, which sometimes we can see and sometimes we won't be able to, we'll just have to see how that works, is called the epiglottis, or over the glottis. And it's the thing that, when you swallow, closes over the glottis so it doesn't go down to your lungs. And so if you laugh or something like this while you are swallowing water or drinking a Coke or something like that, then the glottis opens and then tries to close back again, and it may let water go down the wrong tube we talk about, and that's really what's happening. It's going to the wrong tube, going down to your lungs, and then you're coughing and gagging it all up. All right, more about that later. All right, papillae, which are the taste buds, and there's a bunch of those all over the tongue of different kinds. I'll talk more about that later. Obviously, that's just the tongue, and then there's some more papillae at the front, or taste buds. A lot of times you will see, we used to see labs, you still do see labs, where they say, oh, if you touch this part of your tongue, you taste salty, and this part is sweet and whatever. But really, taste buds are scattered all throughout your tongue, it turns out. And you can taste a lot of them. Now, there may be slightly more in some areas than others, but for the most part, all the different tastes are scattered all the way throughout your tongue. All right, and that'll be a good place to start, and hopefully we'll be through testing tomorrow, and we will be back to a semi-normal classroom. All right, have a great day, and we will see you tomorrow.